Good morning.
Morning, sir.
We'll continue from where we stopped in our last class. Today we'll look at types of sterile preparations. In this topic, in as much as this is a kind of dispensing, but at least we are talking about sterile compounding. So there's need for us to mention one or two things. Discuss in case you have not done it. Discuss sterile preparations. So we look at the types of sterile preparations. So we are still on the course HCP 362, Industrial Pharmacy Practice. Industrial Pharmacy Practice. So let's look at what we have on sterile preparations. So let me also inform you that henceforth from today, we have our class 9 a.m. to 11 a.m. Then that between that 9 a.m. and 11 a.m. we'll try as much as possible to do something on HCP 362 and at the same time do something on AUM for your tutorial, because I was informed that it's better I just squeeze out time from your normal lecture so we can do the tutorial, because it's clear that you people will not come for tutorials, so you said not to come. So I'll try as much as possible to squeeze out some time to talk about AUM, because that's what the school says you should be doing your tutorials. So that's what we'll be doing from now. So I said, let me inform you. All right, so we look at the types of sterile preparations. Sorry, this class is a continuation of what we did in please, if you're not in the good mood for this lecture, please don't disrupt my class. Just go out quietly. It's more honorable than to stay and be constituting nuisance. All right. So basically, as we discussed in the last class, we know that sterile preparation should be devoid of what? Microorganisms. We know that, right? Dust, fibers, or any form of foreign particles. So it should be devoid of that. And we are going to look at these sterile preparations under two categories. We look at it from the parenteral preparations, and the parenteral preparations. We look at injections. We have injections that there. We have transfusions, solids. We have sterile solutions, even emulsions. Some emulsions are also expected to be what? Sterile. Then we have the ophthalmic preparations. So we have the parenteral that are not ophthalmic. Then we have those that are under what? Ophthalmic. You have things like eye ointment, eye drops, gels, even suspensions. So let's look at the injectables. That is the sterile preparations that are in injection form. So now injections, as you all know, I told you in our last class that injection should be devoid of what? Microorganisms, right? At the same time, it should be what? Isotonic. It should be what? Isotonic. So when a solution is isotonic, you know what it means, right? What does it mean? Who can tell us? When something is said to is isotonic, what does it mean? In between what? That is not.
The concentration of or for example, the injection is the same as the concentration of the cell. So therefore, there is no bursting of the cell, neither is the cell drying off.
So you know that these things are going directly into the bloodstream, and they also they are also in contact with the what? With the cells. So it's very important that they are of this. Of course, you know in your farm calc now, you know how to make a solution isotonic, right? You know how to make a solution isotonic. You don't know? All right. That should be a topic in your farm calc. All right. So let's move. Now, of course, injection should be what? Sterile. They should be what? Pyrogen free. That one is there. And the parenterals, of course, when you hear the term parenteral, what does it mean? Outside, right? Enteron is what? Is what? Where? Inside where? No, that is not it. And enteron is where?
Enteron outside.
Outside where? Outside what? No, that is the injection. The injection does it get inside the body? So then it is still parenteral. So why would we say inside the body? Which part of the body? Where?
In the vein.
Enteral means what? Enteral means what? Yes, that's the question. Where? These are things you should know by now.
Enteral means gastrointestinal.
Didn't you do rounds of drug administration? So why are you making me feel as if you were not taught? So you did it without knowing what enteral means.
They just like surface.
Which one is the surface?
Like briefly.
Brief. So you briefly wrote the exam and briefly passed. And soon you will briefly graduate.
God will use you for us.
And you briefly graduate and go and be embarrassing yourself that you don't know, even if you were not taught. Once a topic has been mentioned, go and study. That's the point I'm making. Go and study, even if they didn't go deep.
Okay.
Your phone? What is it for? You are giving material. You see entera. You don't know what entera means. You just cram it and wrote the exam. What is your phone doing for you? You look it up. That is how to study. I keep saying this. Everything must not be given to you like this. Once it has been mentioned, and there are some key concepts you don't understand. That is why you should study, research and study. Don't relax and say you were not taught. Soon you will leave here and start working. Is that what we see? Of course, I don't know. Makes no sense. Please, don't tell me sorry. Be sorry for yourself first. Feel sorry for yourself. Then after that, now you start working. That's the point. Don't tell me sorry. Doesn't make sense at all. All right. So it talks about, just as he said, the GIT, right? So once it enters. That's why we have the enteral route and parenteral route. Yes, even though yes, the injection enters the body, other drug, other routes they can enter the body, but not all of them enters the what? The GIT. True of us. Those ones are the enteral. They are under what? Enteral. So the one outside the GIT are what? Par means outside. Enteral, the what? GIT. So please understand these key concepts, so you don't end up cramming what you don't know. All right. So now, of course, we all know that the injections are used for what? For when we have when rapid response is required in emergency situation, right? We know that. So those ones, I'm just using this topic. I wanted to ignore this because that is not, but it's not pure industrial practice. But at the same time, I was like, I don't know how far what you did there. That's why I'm trying to, and you have made me, you are giving me more reason to talk about it now. Now, of course, most injections, we have the one that goes where? We have the one that goes where? The veins. We have the one that goes even to the artery, directly to the what? Artery. And we have the one that goes to the muscles. We have the one that goes to the skin. The skin, the subcutaneous tissue layer. So all this, they take their name from all these different routes through which they enter the body. So they take their names. So now, as you can see, there's need for it to be of the same tonicity with the body fluid. There's need for this preparation to be of the same tonicity with the what? The body fluid, to avoid issues. To avoid what? Issues, just as he said. From your basic biology, your biology, that what happens to the cell. That the way we talk about cell, the cell we talk about are cells inside your body. So whatever that is coming in contact, fluid that come in contact with them should be of the same tonicity, to avoid leaving or entering too much, then destroying the cell and causing issues. Now, there are we have different routes. We have the intra-articular. Intra-articular means what? That is in the what? The synovial fluid, the joint fluid. Articular. So this joint fluid, whatever that is entering that joint fluid, should be of the same tonicity with the what? And it should also be devoid of what? Microorganism. And microcommunicating is very important. Remember the topic we are talking about what? The what? Sterilization and what? We are talking about what? Sterility and what? Sterilization of what? Materials and even preparations. So that's why I'm taking the lecture in this way. So now, another one another thing I also wanted to understand, we also have the one that enters the what? The spinal column. So what is the route of administration that enters the what? That where the preparation gets in contact with the spinal fluid. What is that preparation? Intrathecal. God bless you. Intra what? Thecal. So intrathecal, they also come in contact. You do it as if this is the first time you hear that word, and you are in final year. Child, there is trouble, very big trouble, and I want you to surmount it now. Surmount it now. No time for play. No time for play at all. I'm seeing a lot of loopholes that we need to be covered on time for the safety of our patients out there. All right, let's continue. So, intra what? Thecal. Then we have the one under the skin is what? Subcutaneous, yes. Example of drug that you can give to that means?
Adrenaline injection.
Is it true?
Yes.
Is it true?
Yes.
Is it true?
According to what I've so when a patient is having allergy, when he's having asthma, so you do give the adrenaline 0.5.
Who agree with her here? Nobody. No, man, nobody agree with you.
Ma, we not know it too.
Give us your reference.
My
Reference. Give us your reference.
reference.
Yeah. So we can agree with you. Nobody agrees with you.
When my director at
Okay, make more. Don't say your director. That's a wrong. Even if you see a director doing it, go and research on it.
Okay.
And find out why your director is doing that. That's how to learn. Don't sit down and see a director doing what something. You keep quiet. Go and do what? Research it and find out why your director is doing what. You know, it's not the director. You say your director is doing. That's a wrong thing for an educated person. Understand where I'm going to. Don't argue about it.
Even that time, sir,
So immediately you see that, so since then for the past 3 years you'll be here. Have you bothered to search it, find out why he's doing that thing? That is how to study. So because of that thing, I don't want to comment on that. You go and research on that. In the next class, tell us why, whether truly, give us reference truly, whether adrenaline can be administered through that means. Am I communicating? Yes. That is how. But as popular one, we know, we see people do almost all the time. That you even see them doing it. So popular. Insulin, right? Good. ACT injection. ACT. I heard ACT now. Please, hello. This sounds funny, but it's not funny at all. It sounds funny, but it's not funny. Some are still playing until when you live here, you understand what I'm talking about. When you live here and see how empty you are, you'll be angry with yourself. So please, I want us to study. I'm sorry to say this, so I keep saying it. You people don't study. I mean it. I can beat my chest. Only few. Majority don't study. Start doing something. I keep saying this thing. You may not like what I'm saying, but I'll keep saying it. Don't study. Only few study here. And I don't know why. Maybe you thought here, let me just come and tear this license and go. It's not like that. You're in a serious professional course. It's not like that. It's not like that. I said that I will not come today. I will not come today. That's the information I gave because yes, I went to somewhere. Now, but when I didn't stay up to more than the number of days I planned. I came back on time. I deemed necessary to come for class and teach you. I saw some human beings going up and down with mufti. I asked them, why are you not in class? They said, we are told they have no class. They just told us that's class. I was like, sure. So because of that, now you are now walking up and down. So it makes no sense. On seriousness is on the peak. And I don't know why that thing happens. God save our healthcare in near future. God save us. We are in trouble, serious trouble. I keep saying that. On serious sense, people have infiltrated our healthcare sector. On serious set of people have infiltrated our healthcare sector, and it's a problem. It's a time bomb. You will not understand until your own person land in the hand of someone that don't know what he's doing, and a life is lost because of your own person is in the hand of someone that don't know what he's doing. That will you understand what I'm saying. You may say, you may think it's nothing until it happens to you. Then you understand what I'm saying. That your own person land in the hand of someone that wasted his time in school. And that's what most of you are doing here. And that's what I'm trying to correct. You may think it's a joke. No. As you are unserious here, some other human beings are somewhere else unserious too. Let's be serious in what you are doing. If you cannot do this course, leave it and go. Go and do other things. Go and learn how to sew clothes. You make money and become a millionaire. There are fashion designers that are billionaires today. You must not be here. That's what I'm making. But if you are here, put your mind in it and do what? Take it serious. Know that you are saving life, not to make money. Take it seriously. That I'm not seeing seriousness since I entered it. I'm sure to see. I keep saying, what am I even saying? Even say some of you lecturers say, I have even confirmed this that people are not serious. Jokes apart, I will not lie to you. I go lie for you. I will not lie for you. So be serious. Be serious. Yes. I don't want to mention them. Management, top management, that you have become not serious, and it's true. It's true. It makes no sense. It makes no sense. I'll keep shouting, keep talking, so that in the few years to come, you remember that someone like me was hammering on this issue. I can't keep quiet. That's who I am. Anywhere I am, I must talk, say my own. So you to be on record that I did my part. So let's continue. So that word subcutaneous. Of course, when you use I'm not supposed to be talking about this, but what my own is just to talk about how sterile they are, move on into that thing. But hello, are we together? Please, let's now. Don't worry, I've agreed. Don't worry, I've agreed. Hi, God. All right, so another thing I want us to note on this route of administration, we are taking three things at the same time. I'm trying to take three things at the same time, mentioning the necessity to talk about some type of them examples of what you can use to. Now, then there are some of them that are purely vascular. Purely vascular. As I said before, now those ones are there for what? Rapid action, and also for optimum blood level. That's why they say that IVs have what? 100% what? Bioavailability. 100% what? Bioavailability. So imagine what is going to the bloodstreams directly, and that thing is loaded with microorganisms. That one is what do we call disseminated infection, bacterial infection in the system. What is it called? Good morning. Thank you. What is it called? There's a name we call it now. Where in fact that one is even worse scenario. Is not local. This one is now disseminated. The blood is what? What is sepsis? What is sepsis? Infection. What is sepsis? Which is infection? What is sepsis? So infection is sepsis. Infection, sepsis. What is sepsis?
Sepsis is the presence of microorganisms.
Okay.
Like bacteria, viruses,
Is that what sepsis actually is?
sepsis.
When something has been contaminated, totally contaminated.
Please silence your phone, please. Sepsis is what? Can you look it up? Look it up. Feel free, look it up. Look up what sepsis is. At least if you have not been using your phone to study, use it now in my presence. Yeah, check your sepsis.
When chemical release in the bloodstream to fight an infection triggers inflammation throughout the body.
That's what I want to hear. That in the bloodstream that disseminated. That one is it now go to all parts of the body. It's not just about infection now. It has now entered the bloodstream, and once it enters the bloodstream, it's a serious
Triggers inflammation.
situation. Is that clear? It's a serious situation. It's a serious situation. Now, what's going on? Is that real? Huh?
No,
Okay.
it's a trailer.
Okay. So what am I said that this is where when we need what optimum what blood level of the what would I even say that led to that sepsis? I was saying something.
If the injection, imagine if an injection.
Okay, good. So imagine if that injection is not sterile. Apart from the toxicity, let's talk about now the microbial load. If it's not sterile at all, so what will happen? It's a problem. Sepsis will do what? Take place. True of us, but did it enter the bloodstream straight?
I don't mean to put you this sepsis wrongly then, because some people, if somebody has infection, you say the person has sepsis.
That's a problem. If someone has an infection, that sepsis is. If you have infection, am I communicating? Now, I don't know the situation, so I wouldn't say anything. I'll say that they are wrong or right because I don't know what they're trying to do. What describe? Am I communicating? I don't know if somebody has an injury here, and the pus comes out of here, and the person started saying that the person has infect. What about I wait now? That the person has infection here, in the leg here, and there's an injury here, infection, pus coming out, and someone come and say the sepsis. That was a different not together. Is that what they're trying to describe? No, by judging from what you said, is that what the person is trying to describe using
Something like that.
sepsis?
The person has sepsis.
Sepsis is beyond that. Sepsis is general as bloodstream must be. Someone can have infection here, but if you have that infection here, and if it's not well taken care of, it can lead to that.
And some people say that because one of my family members had a baby recently, I think it was not the second day, and they said that it was running temperature. So when I would take baby downstairs, we went to check the temperature, it was around 37. So they're not like that. Baby has sepsis. I was like, sepsis. How?
Sepsis, no test,
No, they didn't do test.
and they say it's sepsis. Please, I don't. Please, don't continue. I can't say. I can't talk.
So looking at this definition now, like they didn't give the baby injection as of yet.
This is what sepsis is now. Are we good now? So whatever they are trying to describe, I don't know what they are trying to describe, but this is what sepsis is. So whenever you hear sepsis, this is the medical meaning of what sepsis. Okay. Now, so that we also inform of the fact that the IV is important, that the IVs are what? Sterile. That they are what? Sterile. Very, very what? Important. Of course, you know that when it comes to IV, absorption is not an issue, because that has no business with what? Absorption. True of us. Because the main purpose of absorption is that they let whatever the content, the drug in the medicine you take enters the bloodstream, because it's the blood that will not take it to blood that will not involve in the distribution. True of us. So if the IV the injection is going directly into the bloodstream, there's no need for absorption. True of us. It has no business with what? Absorption. So that's why I say that absorption is not an issue. It's not an issue. And that's why, because of that now, that's why you need to be careful. Even from the point of preparation and the point of administration of what? injections, IVs. That's why you should, in fact, IV itself should be given what? You don't pack everything, boom. True of us, you don't pack everything like that. Do the system. Take it what? Slowly. So that if there's any issue, you can easily do what? You trace your step. And as you do it, you are watching your patient. Yes, for those of you that are, because some of you are nurses already.
Sir, is it very strict for when you are applying intravenously for the patient to lie down, or is there a fix like this?
The most important thing is that let there be gradient between this and the where you the what you are the whatever means you are giving what the IV. Let that be kind of gradient. Whether the person is lying down or sitting down is not an issue.
As long as you have.
Let that be gradient. That was the important thing. Yeah.
So I wonder what those injections that when they're giving it IV, like you feel it like paining you when it's entering your body.
And now,
Are those kind of, you're supposed to be giving IV?
so far they have compounded it in that form. You can give it IV.
Going to pain the person.
Every injection
Well,
of their own.
why won't it pain? It pain, but the severity of pain may not be the same thing. And at the same time, the scale is also important, because we have different scales of administering. There are people that I don't know how they do their own. That's why you see some people, they'll tell you this person's hand is painful. This person's hand is not painful. Even if it's painful, you will not feel it as such. It is a scale.
Scale as
How the person.
scale as
Scale, SISKILL. You don't know that drug administration is a scale.
Okay, it's not for everybody.
You have to acquire a scale to be able to do that well now. Yeah, you have to acquire a scale. It's not just about knowing it in your head. That's why you do what? You learn, you practice it, try to do. Yeah. So there are some people that, and also, as you are now, we have anatomical differences. Sometimes this point where they think, remember there are nerves there now. Remember there are nerves there now. And what brings the sensation is not nerves.
Yes.
So our level of reception of all these pains are not dissenting. It also differ from people to people. So there are a lot of factors that lead to that. A lot of factors contribute to that pain. A lot of factors contribute to that. If it were to be IM, it's okay. Use lidocaine now to see if you can live. But for the IV, you cannot use lidocaine now for IV. Am I communicating?
Yes.
Have you? Okay. You use lidocaine for IV.
I don't see that. I think you're going to pay someone.
Shush.
Yes.
It's painful.
Yes.
Why? How?
It's painful.
How? What is lidocaine?
What is
Lidocaine is a local anesthesia now.
What is lidocaine?
It's a local anesthesia.
So how does it pain? How does it pain? How
why they are giving you that?
how does it cause pain?
Yes.
So
Okay.
after the giving, will you feel pain again?
Okay. Lidocaine is okay. Lidocaine is the cause of the pain.
No, that's not that.
Suppress the pain now.
I want to understand something. I heard lidocaine is painful.
No, it's not painful.
So why did
When they use it to dilute this thing, it's still painful, like you still feel it.
The thing is, the reason why lidocaine is there is to reduce the pain. If we were to give you a load, you will just meet yourself. Hallelujah.
I'm hearing
If you
anything.
reduce, it might not. That's why it's called local anesthesia. It's not for that area. Not for. You cannot know the other part of the nerves.
I don't hear.
The thing is, if it's like that to give you without lidocaine, it will be worse.
They like
Yeah, in class, use the formal
You see that injection itself.
Hello, please. Hello, please. Sorry, no verse. Don't be offended, please. We are in a formal setting, please. We need to understand what they're saying.
Yes.
Now we understand. We are formal class, please. I beg you. Okay. You didn't know that you were not speaking what me. So I didn't understand what you were saying. Please, I beg you. Please, I beg you. At least, even if you cannot speak purely, speak pidgin. We all can understand that one, right? Please, we are in class. All right, so let's continue, please. I just heard it for the first time that the is painful. Wow. I'm not arguing, I'll research on that too. That's how I behave, man. That's how I do my own thing. I can't argue with you. I just heard a new thing today. I will now go back and do what? The last I checked, the reason for that is for to do what?
So from after they give you that spot, they give you that become blank like
No problem. I'll find out whether it's true, then why it happens. Is that clear?
Yes.
I'll find out. So I will encourage us to also find out whether it's true and why it happens. So let's continue. So we also have. Okay, we've mentioned the subcutaneous route, right? Subcutaneous route, right? Please, subcutaneous route is normally used for small volume medication, just small. That's why if you see your insulin syringe, very tiny, right? Just small volume, not for just very small volume. That is for what? Subcutaneous. Please note this point. And of course, what part of the body do they normally administer subcutaneous injection? What part of the body? Upper what?
The upper arm, and thigh, and the abdomen.
Speak like people that did physiology and anatomy. What happened? What is the name? What is the name?
The name of the.
Yeah, speak like some people that goes.
Upper arm.
Which is upper arm?
The upper part of the shoulder.
Which is upper arm? Speak like people that did physiology and anatomy. Please. Once you go to Panay, speak like people that did physiology. And that's why you will do physiology. Because if you go there, that's what you will see. You will not see upper arm. What do you see? Those names.
The anterior arm and the lower abdomen, the posterior abdomen.
Where is deltoid region? Deltoid. Yes,
We
someone
know
is the
it.
deltoid.
But it's just that this
Where is deltoid?
We did it for the first semester.
You don't know it now.
We know it, sir.
Where is the deltoid region?
Sir, we forgot to know it.
Abdomen.
There are some things that
You don't know
you
it.
might have taught you.
You don't know it. You don't know it. Which one is you know it? You have forgotten.
See.
You don't know it. You don't know it. I'm not asking whether you have done it. I say hello. I'm not asking whether you have done it. I'm asking if you know it. That's the question. See. Hello. It's peppering her that I'm telling you. You don't like hearing the truth. It's peppering her. Yes. You don't know it. So show me you are the region.
Deltoid region is the stomach. That's
Stomach. Deltoid.
abdomen.
Abdomen. Deltoid. Abdomen.
Sir, please tell us.
By the time I'm done with you, you go and study. You don't read. There's no mercy there. You don't study. Take it or leave it. If you like verse, you don't study. You don't study, and I'm angry about it. So it's not to make you happy. I'm angry about it that you don't study. So if you are angry, the best way to show that anger is to go home and dust your book and study. That's anger. That is how to show me that you are angry, not to be talking nonsense here. If you are angry, calm down, then go back and do what? Start studying. That's all. That is right. That is the right attitude to it. Uh-huh.
The deltoid
Is where?
from the shoulder to
Uh-huh.
the upper arm. This side.
Good. That's our deltoid what? Region. Is that clear? Let's continue.
When they stop
This is the elementary physiology.
sterilization.
Elementary physiology and anatomy. So I know what I'm doing. So don't come here and be doing things like as if I have offended you. If you feel offended, go and study, go and read. You should know it by now. Now, another point I want to make here is that another point I want to make here. Okay, I've told you about that whatever is going in through what subcutaneous should be what small what volume, right? Small volume, very important. You know that place is not like a muscle that can accommodate much. But I hope you know the subcutaneous, is somehow just in between, just that fatty. So it's not. It doesn't need to accumulate. It cannot contain much
liquid
volume. Yes. So it will lead into another thing altogether.
Sorry, so once it's inside once that is administered something, so how does it go to how does it get distributed?
We have capillary beds scattered all over the. We have capillaries.
So the capillaries
Capillary
will
will
absorb
and
the
enter vein, from capillary to venous, then vein, and then they will start going to other part of the body. So you have capillary beds scattered in different part of your body. I've mentioned interarticular, right? Right?
No, sir.
Interarticular, joint fluid, synovial joint. Example: this joint here now, where for patients that have this one is directly into the joint fluids. It's painful now, but not bone. That's synovial cavity. Give me a marker. In your you just use one joint. Let's just use this one. Of course, you know what happens here. We have bones, right? This bone is here. This bone is here. This bone is here. So, am I concreting? So this space here, synovial cavity, we have fluid here. So when this fluid gets dry up, of course, on this surface of this bone, we have cartilage. Synovial cartilage is there, right? So these two, they are not meant to. There should not be friction there. But if this fluid dries up due to one is not the other, they will start. Is that friction that is causing the issue? Is that clear? And so drug can be administered directly inside this. So this was, what causes that? Is it what? What causes arthritis?
I said, is that the
Yes. Once they wear out, once they start their friction, the cartilage do what? Wear out.
What can dry the fluid?
A lot of things it can classify a lot of factors a lot of things.
That is problem. Because we will not know the time that the thing is getting dry, not until you are having pains.
Do you know why sometimes I throw questions? Because if I go into this now, I will be teaching physiology, and my own time for my own course will go, and I will not teach anything. That's why sometimes I throw you question, tell you to go and do what? This is pure musculoskeletal system in your physiology and anatomy. So I don't know. I wouldn't want to go into that. And even in your second year, AUM, first semester, your musculoskeletal system drugs. And what happens, the diseases and the drugs, these things are there. It's well. Maybe it's well. But my target is to finish what I should cover in my course, because I will judge by what my own course, not other course. So I wouldn't want to go and start dwelling into all these things and leave what I should teach you. Please let me see how far I can go on the one I can. But this basically what happens, okay? Now, if this wears out, so the drug. Why I do this is to tell you that some drug can actually be directly there. So.
Is to take a professional.
Oh, you know, yeah, of course. Now it's not what anybody can do. Any it's not. It takes. It's not. You can't even do it in any hospital around. It's not. It's another level. It's not just what you can just do anyhow. Okay, so now another point I want to make here is that of course now I am is what? Muscles, right? Skeletal muscles, right? Mainly gluteus maximus. We can also have some IM here too. In the deltoid, even here too, some IM can also be administered there. Of course, just as you see, there's also, and at that level, we also have capillaries that do what? But the rate at which, of course, they will take time. The bioavailability of that of the IM is not the same thing with that of what? IV. Hope you know, because it has to enter what? The capillary, right? Before it now enter the what? The vein, yes. But unlike IV that goes straight to the what? The vein. Now, also there are some special access to some muscles. Sometimes some devices may be employed. That just as you see, sometimes some devices. We have venous catheters and other depending on the case anyway. Depending on the case, some devices may be employed to be able to do what? Administer some of these injections. So that's the point I'm trying to make here. Now, but in all, whatever you are doing so far is entering the parenteral route. There is need for it to be what? Sterile. That is the key word. That is the key word. Now, the drugs, injections. We have injections. We have injections where you have. That one it just contains this drug substance in solution. Just as you see, you have furosemide injection, right? You have furosemide injection. You've seen it before, right? It's liquid, right? Just like that one. And some other one that are liquid, just like that. That one are what? Just injection what? Solutions. Is that clear? And we also have injection as we call them generally. We call them for injections. Things like powder for injection. Are we together? Things like powder for what? Injection. Powder for injection. Then you have I think I don't know whether it was in this class that I told you that that because of the nature of a particular drug, you see a drug, the drug may not be formulated as solution. It may be formulated maybe because of because of maybe in solution or in liquid form, it will degrade before the use. So you see them preparing it as what? Powder. So that at the point of use, you do what? Reconstitute, then use. That's why you see some drugs like that, like your ceftriaxone, and what have you ever seen ceftriaxone or even cefprozime? Have you ever seen cefprozime solution? Even cefprozime as for oral route is tablets, not suspension, powder for suspension. Powder is not suspension, but things like flagell can be in liquid form and nothing will happen. Is that clear? So this forms the reason why you see them like that. So under injection we also have for injection. As I said before, now you see things like here you see dry solid that can yield what solutions when they do what reconstitute. Cetirizine is an example. Then we also have emulsion that are injectables. We have emulsions, prefabricated as emulsion, prefabricated as what? Emulsion. So this one is liquid preparation that contains the solid or solid substance in what? Solution, just as what? Emulsion. Just things like propofol.
Does it mean that it exists in a liquid form, but
Yes.
you have to add it to another liquid?
No, it's on its own. It comes like that on its own. The liquid in the bottle is the emulsion. Is liquid. It's not. You are not missing it. It's liquid. Unless you want to do other things, do dilution by yourself for this best known to you. But it comes as what? Liquid. Is that clear? So that's the one we call injectable what? Emulsion. We also have